A key COVID-19 model is out with a new alarming forecast, projecting the number of coronavirus deaths in Canada will soar, adding more than 8,000 new fatalities by the end of the year.
Like any respiratory virus, they hit us harder in winter.
Dr. Ali Mokdad is with the University of Washington's Institute for Health Metrics and Evaluation, or IHME, which is predicting more than 17,500 COVID-19 deaths nationwide in Canada by January 1st. A dramatic jump from the current more than 9,200 confirmed coronavirus fatalities.
This is a new virus. We're still learning a lot about it. But if you look at even from the Spanish flu, the second wave came in winter and it was way, way higher. We know from the flu, we know from pneumonia, we know all these viruses love winter, love us to come inside.
The Centers for Disease Control and Prevention estimates the 1918 or Spanish flu resulted in at least 50 million deaths worldwide. Most fatalities came during the second wave in the fall of 1918.
Would you classify what we're about to see in the fall as a second wave?
Second wave means you went down to zero and then you start all over. So New Zealand had the second wave. We in the US and in Canada, we're still in this first wave that is dragging.
But Dr. Mokdad says physical distancing, hand washing, and mask wearing can stem the spread of the virus. According to the IHME, if mask usage is near universal at 95%, scores of lives could be saved by January 1st.
In terms of the Canadian projections, they're interesting because if you dig down and you look province by province, they're basically entirely driven by Ontario and Quebec. So the assumption is that the rest of the provinces will have very, very few deaths moving into the winter. And I would say I have less confidence in those projections because we are starting to see increases in cases in BC and in Alberta in particular.
Infectious disease epidemiologist Dr. Ashley Toot says the IHME's projection is not outside the realm of possibility.
The challenge with the projection is that it sort of serves as a way of showing us this is a potential future that we could see, but it's not necessarily the future we will see because we will respond, we will see what's happening, and we will hopefully prevent this from happening.
While the modeling is often cited by top U.S. officials, including the White House, and is used by the CDC, there's been pushback. As NPR reports, the dean of Brown University's School of Public Health says he finds IHME's forecasts highly implausible. Among his critiques, IHME's team assumes that people who are infected with coronavirus in the coming months will die at the same rates as those who were infected earlier on in the pandemic. He says we've gotten so much better at taking care of sick patients. There are epidemiologists who believe any projection beyond just a few weeks into the future is useless. Nick Wright, an epidemiologist at the University of Massachusetts, tells the Washington Post, models are heavily dependent on untested assumptions about what will happen in the future, a limitation Dr. Mokdad acknowledges.
I'm more confident 2 weeks into the future, less confident a month, less confident 4 months into the future.
But long-term projections can help plan for an uncertain future, he argues. The Public Health Agency of Canada has not publicly released specific forecasting numbers through the fall. Instead, they've shared illustrations of two scenarios. One, the slow burn on top, is what they're aiming for, keeping case rates low and within the public health system's capacity to manage. The other is what they call a reasonable worst-case scenario, with a large fall peak followed by ongoing peaks and valleys. And on Friday, Canada's Deputy Chief Public Health Officer weighing in on the recent jump in new cases.
Everyone's concerned about the ongoing increase. The trend is going the wrong way.
As for the U.S., the number of coronavirus deaths there right now is around 200,000. And that modeling we've been showing you is now projecting that number will soar, expected to reach around 378,000 by the end of the year. Melissa Duggan, City News.